My name is, as heard, Cecil Konijnendijk, and I am the outgoing coordinator of Division 6. We have a fantastic new coordinator, Purabi Bose, who is taking over. But I'm also the chair of the Global Forest Expert Panel on Forest and Human Health, which is kind of the focus, I would say, of this session, or a large part of this session. So just a little bit about the format. So Christoph Wildburger and I will give a brief introduction to the topic, a little bit about the work we've been doing in the GFEP on forest and human health. Then we have a panel with actually 5 very distinguished panel members, whom I will introduce shortly. We'll have one person online as well. And after that, we'll have our first experiment with these flash talks. So every session, or most sessions, will have some very concise, very brief talks. And actually, in our case, we have talks from 4 different continents on the topic of forest and human health, which is, I think, fantastic. It will be really interesting to see how it works, because we have some people here, some people live online, and then we also have some recordings. So we'll see how we manage, and it will be a bit of a technological challenge, but we'll do our best. So the topic of forest and human health, obviously, is a very broad topic. So people like myself, who live in the global north and are living in cities, we think about things like going to the forest to de-stress, to feel better, to have maybe some physical exercise, or go to the park to have social interactions. And of course, during the COVID-19 pandemic, we've seen the immense importance of urban green spaces and urban forests. But in the GFEP panel on forest and human health, of course, we realize that these relationships are much more complex. If you're in the global south, if you're in rural areas, or if you're a forest-dependent community member, your relation in terms of health is quite different from somebody living in urban areas. So the discussion today will focus on what we call a One Health perspective, and I will introduce that in a little bit. But I would first like to ask the coordinator of the GFEP program, Christoph Wildburger, who is also somebody with a long experience in forest governance processes and consultancy work, etc., to say a few words about the GFEP project. Christoph.
Short break. Now it starts. Yes. Yes, thank you very much for introduction, Cecil. I would first of all, actually, I'm pleased to welcome you on behalf of the Global Forest Expert Panels program of GFEP, and I'm the coordinator of the program. I will just very briefly introduce the program to you, and also explain the background of our recent assessment on the relation between forest and human health. The GFEP program of IUFRO is the core of IUFRO's work at the science policy interface. What do? We combine diverse expertise to assess scientific knowledge that is important for achieving global forest-related goals, policy goals, and we try to inform political decision-making in that. How do we do that? You see a rather simple graph here, but to explain that is that we first of all select topics that are very relevant and high on the agenda in forest-related policy processes. Then we establish expert panels with scientific experts from all around the world, renowned experts. These are multidisciplinary panels. They work on an assessment of the topic and in an interdisciplinary manner. And through that, we come to reports that are peer-reviewed and that are published by us. We share that widely with our target groups and with stakeholders and decision makers. And most importantly, we try to feed them into the policy process that are relevant for these topics. For example, I take the CBD now for our health assessment. We will feed that into the CBD. Yes, just to give you an overview, in the last 15 years, we published a series of assessments on several topics of the Sustainable Development Agenda. The most recent ones were on forest and poverty evaluation and the impacts of REDD+ implementation in the last 10 years. And now we are, as I said, we are initiated the Global Forest Expert Panel on Forest and Human Health. So why did we choose forest and human health? Yes, we were hearing about the Sustainable Development Goals already in our keynote speech today. And if you want to achieve the Sustainable Development Goals, you also have to see the linkages between them. And if you want to achieve the Sustainable Development Goal 3 on good health and well-being, you also have to consider all other aspects, including how forests contribute to that, and how the linkages are to the SDG 15 that we heard about already on the, well, life on land it's called, which includes, of course, to a large extent also forests. Why are forests important now? I mean, forests contribute to human well-being. We all know that. There is a lot of evidence on that and can increase human health. There are, I mean, we will dive deeper into that, of course. There are the main services that are well known. It's recreation, for example. It's income generation, it's food security and nutrition, it's water purification and air purification, and also the role of forest as a buffer in times of environmental crisis, for example. But we will dive deeper into the, dive deeper into that later on. The relationship between forest and human health is a complex one. It's not only just a benefit. There are also challenges, of course. And the most important one, of course, are quite evident now. It's the evidence that people who are living closer to forests are more prone to zoonotic and infectious diseases. For example, COVID was this example now. And of course, they are also more likely to get into a human-wildlife conflict. This is also quite evident. Yes, this anyway, if you look at that, it's quite clear that the interactions between forest and human health are quite complex. They are multifaceted, and we need a very deep dive, scientific dive into that. And this kind of was the reason why we initiated this assessment. When we did the scoping for this assessment, we invited both the scientific community as well as the representatives of the policy processes for a discussion. And on basis of the outcomes, we then defined the scope, and the main elements are that we will address the different dimensions of the relationship between forest and human health. Then, very importantly, we will also address the synergies and trade-offs between human health and the conservation, the restoration, and also sustainable management of forests. And also, very importantly, we will try to show the different response options for the political decision-making. Yes, with that, actually, I will stop here now. I would like to also invite you to take publications that there are hard copies out there at our desk, at the IUFRO desk out there, and you can find all our publications, of course, on our website and download the files. Yes, please.
Yeah. Thanks so much, Christoph, also for supporting this this important work. Oh, we lost our slide. I hope it's coming back. Yeah, here we go. Yeah, so just a little bit more about the GFEP team for this really interesting assessment. We are, I think, 19 people from all over the world. We have several representatives from all over the world with us. And the structure of the report is as such. So we have, of course, an introduction, and we have a kind of a theoretical framing where actually Rosalind, who I will introduce in a second, is heavily involved. We have a chapter on current evidence, which is quite a hefty chapter, as you can imagine, where Sjerp is one of the co-leads. Then we have a chapter on the characteristics of forest and synergies and trade-offs in relation to human health. And one of the authors of that chapter is Iwao, who I will introduce in a bit. And then also a very important chapter on response options led by Agnes van den Berg. And actually Lisa Terwijnen, who is the lead of chapter 4, will be with us online in a bit as well. And then, of course, the important chapter in the end is the conclusions and perspectives, the policy recommendations chapter as well. So just a few piece of ground information, maybe some highlights so far. And I said we're in the process. We're working towards a publication in March, a launch of the report in March next year. And of course, health should be taken very broadly. So this is not only about you feeling ill or not, but it's about the general state of health and well-being, which relates to physical health, social health, mental health, according to the World Health Organization. And we take that really broad perspective. And sometimes even kind of cognitive development is seen as part of the health agenda as well. Well, in chapter 3, one of the things that's done there is kind of listing out the changes in how diseases, or morbidity as we call it, is impacted by different diseases, different lifestyles. And we've seen over the last years quite a dramatic shift in where people are getting ill from. So we see things like heart disease, cardiovascular diseases, stress. They're becoming more and more of a factor in ill health. And of course, that also has to do with our lifestyles in many ways. And we see shifts, of course, in lifestyles, not only in the global north, but actually also in the global south, where lifestyles are changing, people are moving to cities, etc., which is really causing some challenges as well. As we heard also this morning from the keynote speakers, forests play multiple roles in terms of the SDGs, and often in terms of where the health benefits, the SDG 3 is placed. You see it's often done kind of towards the city, but of course health has impacts all across the line, and actually many of the SDGs have direct links to health aspects as well, both the positive aspects as maybe the more challenging aspects. But of course, it's not only about urban forests or city forests, it's about forests outside cities, rural forests, and also more remote forests, but we still have a lot of forest-dependent communities that have very different relations, for example, in terms of nutrition and livelihoods to forest. So in urban forestry, there's a lot of work done, or quite a bit of work done, as we'll also touch upon in the panel. What are these benefits, health benefits that we get from green spaces and forest in and near cities? And the field trip yesterday, I guess, gave some impressions, like clean water is a pretty important one, but also recreation. And of course, things like stress restoration, attention restoration, social interactions, etc. This was a publication by the United Nations Economic Commission for Europe that I had the pleasure to author together with them, highlighting some of these important benefits. So one of the things we decided pretty early on is we wanted to take an integrative perspective, a broad perspective on forest and human health relations. And we, in this session, focus on what we call a One Health perspective, which basically says that we're not only looking at the health of us human beings, but we're looking at the health of all beings, including animals and plants. And of course, these healths can be very much related. Think about some of the diseases, zoonotic diseases that we see emerge, not in the least COVID-19. But of course, we've had several diseases where there's a strong link between actually humans and animals as well. So One Health tried to bring that all together, so we have to move beyond the traditional medical perspective on human beings only. And in chapter 2, Rosalind and Mathilde van der Bosch and others have tried to kind of conceptualize some of those emerging frameworks for broadening the health agenda. So we have One Health, we have also planetary health that states that the planet where we live has to be healthy for us humans to be healthy. And then kind of emerging from that is also kind of an eco-health perspective, trying to bring all the different health perspectives, including also planetary health, together. So it's really quite a broad framing of health relationship that we try to bring into the chapter. So obviously, when we talk about human health, we also talk about forest health, which is one reason why we work together also with other divisions in this session. This is a lot of details here, but one of the things that is really key is identifying some of those pathways. So what makes healthy relations between people and forest, but maybe also some of the disturbed interactions with people in forest, where maybe things like forest fires or zoonotic diseases and so are actually threatening our health. And of course, there's a lot of different factors from the experience we have of forest, the use of forest, nutrition, things like microorganisms and soil health, but also things like zoonosis. So there's a lot of different pathways that then lead to either positive health outcomes, and you see there's quite a few there, but also potentially some negative outcomes. A simple one could be eating berries in the forest that are not the right kind and getting poisoned, for example. So health is indeed a very complex aspect when it comes to forest and forestry. Another thing that we put a lot of focus on is, as I mentioned already, is to look at different types of forests and different characteristics. And we kind of look especially at urban, rural, and forest proximate or forest dependent settings, and then try to break down like what are the different forest characteristics and attributes, what are some of the user attributes that play in, resulting then in different health outcomes. So it's a pretty complex field, as said, and we try to break it down in different parts, and in the end, of course, again, then bringing it together for policy recommendations. So some very brief findings so far, and this is really very, very brief, but for most health outcomes, there's a positive link. So we've seen, especially in urban areas where there's more research, that our interaction with forest is generally positive from a health perspective. And that's more so for some things, like, for example, stress reduction, than for others, for example, maybe an effect on cancer, where there's much less evidence. Definitely more work on urban so far than on other areas. And another issue that's really still really prevailing in the research, that the mechanisms are not always that clear. What type of forest, what type of trees, what types of nature are having what types of health impacts? We're starting to get into that, and people like, for example, Sjerp have done quite some work on that, but we're still kind of a little bit unclear about some of those mechanisms. Proximity is very important. So one of the things that I've worked with a lot personally is to try to bring trees and forests close to people, because we know from most of the studies that if people have direct, easy access to forests, then they're actually more likely to get some of those positive health outcomes as well. And as I said, much less work so far has been done in the global south, which is definitely a knowledge gap so far. Now, some of the publications that are out there, if you're interested in this topic, WHO has done some really nice work. Eclipse, which is kind of a cluster of different research activities and groups. Now, Sjerp has been one of the people involved in that, has made some really nice overviews of the evidence, for example, on green and blue spaces. There's a great textbook. One of our lead authors, Mathilde van den Bosch, has co-authored on nature and public health. So there's a lot of interesting evidence out there. We try to bring that all together in the report. I want to also highlight this study by IS Global in Barcelona, who did this kind of European-wide scan, saying, well, 60% of Europeans don't have good access to green space, and that actually could lead up to up to 43,000 excess deaths per year, which is pretty significant, substantial. And of course, you got a little picture there from Vancouver. The COVID-19 pandemic has really highlighted some of these relations again, why we need forests. And I think many of us personally have really experienced that when we were locked down and we were not able to go to the forest, to go to the park, and maybe we could only see trees from our window. And that was already very important for us. In terms of perspective, as said, there's a lot of beneficial relations or impacts, but there could also be some harmful ones. We're covering the full range in the report. We need to keep a broader picture. So issues like food security, and we actually have two panel members today who are experts on that. Spirituality, forest dependence, these are all really part of that agenda as well. And as I mentioned, right, from a planetary health perspective, healthy forests are needed for us to be healthy as well. Synergies and trade-offs need to be managed. Sometimes ecosystem services, health benefits go together. Sometimes there could be conflicts. For example, in the case where we close off forests, for example, for water protection, but then it means also that people cannot go there for recreation. There could also be synergies and trade-offs between different user groups that have to be considered. In general, and this is already a conclusion that we can draw today, even though we're still in the process of finalizing the report, is there needs to be a much better integration of health aspects in the relevant forest policy and also wider global goals and priorities. There's very little to date. One of the first reports that really starting to get into this specifically for forest is the World Forest, the State of the World Forest 2022, that actually uses the word One Health for the first time as well. And of course, then we have to think about response options in terms of governance, spatial planning, management, access, design, education. There's all these different fields where we can actually promote the positive relations between people and forests from a health perspective, but also manage or reduce the negative impacts. And this is from chapter 5, the response options. So one of the really key issues that's highlighted there is this idea of connectedness to nature. If we can connect people to nature, to forests on a daily basis in a positive way, then we're actually much more likely to get all these benefits, health benefits. Well, there's a trend, of course, in society that people get more disconnected from nature. And this is challenging from many ways, many perspectives. If you're less inclined to use forest for recreation, you're probably more challenged in terms of health outcomes. But of course, there are also issues like people maybe not having environmental behavior, policies moving away from nature connected to focus and so forth. So with that, I think it's high time to introduce our distinguished panel. So I think I can and the presentation, and then I'll ask our colleagues if we can bring up, hopefully, Lisa Turvinen as well. And as you do it, I'll introduce the panelists. You've already heard from Christoph Wildburger, our distinguished coordinator of the GFEP program. Then we have Ranaivo. Ranaivo, I have to really make sure I pronounce your, it almost sounds Swedish actually, Ras Olofsson, right? So it is actually almost like, but Ranaivo is not from Sweden, he's from Madagascar originally. And he's a postdoc at Duke University who does a lot of interesting work on nutrition, children, forest, community forestry. So Ranaivo, thanks a lot for making the trip. We're really happy you're here with us. And then we have Rosalind Remans, who is with Biodiversity International, but also has done a lot of interesting social entrepreneurship work, a lot of research, also on food and nature and nutrition aspects as well. So Rosalind, thanks for joining us. And then on my far side is Sjerp de Vries, who is at Wageningen Environmental Research. And I would say is one of the leading researchers worldwide in this field of cultural benefits, recreation, health benefits of green spaces at large. So Sjerp, thanks so much for joining us. And then as we see now on the screen, known to many of you, Professor Lisa Turvinen, who is with Luke, the Finnish Natural Resources Research Institute. And I know Lisa is actually at another conference that's at the same time taking place here, but we're really happy, Lisa, you're joining us today. Welcome. So that's our distinguished panel, and the format will be that I will field some questions to the panel. If there is a chance, we'll try to bring you in, but we are a little bit behind schedule. So we'll focus first on our distinguished experts. And my first question to the panel is, I mean, based on your involvement in GFEP and maybe some of the things I mentioned here today, what are some of the highlights for you, and what are some of the topics you would like to see highlighted in the future research, for example? And I think I'll start actually with you, Ranaivo, if you're okay with that.
Thank you, Cecile. Thank you for the introduction. Well, when I was reading the report, one of the things that's worth highlighting is the unbalanced nature of the evidence there. You said earlier that there are a lot more evidence in the north, global north, than in the global south. And consequently, there are a lot more evidence regarding issues of interest to people in the global north than to people in the global south. For example, there are a lot of evidence about, as you said earlier, green space and mental health. Well, there's mental health problem everywhere, but that issue is a lot more of interest in the global north. I mean, it gains more traction in the global north than in the global south, where the issue is more still about children dying of diarrheal disease, dying of malaria. And I think a lot of work needs to be done there to make sure that there is no section of our global community that are marginalized. I'll give the floor to other people now.
Perfect, Ranaivo. Thanks. Rosalind.
Yeah, thanks a lot. Yeah, I think working together on this report, to me, really struck that the extent of the impact and the interdependencies between forest and human health, like throughout the life cycle, throughout different parts of our body and kind of well-being, and kind of by working together on this, we brought these kind of different pieces together, and really it became much more clear to me all these different pathways and how different pathways work or don't work in different contexts, like you are also referring to, and how different parts are kind of differently prioritized, but all play a role in a way. So I think that extent of the interdependencies between human health and forest really kind of came out very clear to me while we were working together from very different backgrounds and very different disciplines on that. And that brings then together also, I think, some of the urgency to act upon it. I think some of these things have been recognized over time and kind of been brought more to the surface, but by putting them together and also kind of adding the dimension of planetary health that emphasizes how quickly some of these interrelationships are changing, brings out really the urgency to act there. Yeah.
Wonderful, thank you. Sjerp?
Thanks. Yes, well, one of the first things was, wow, there's an enormous amount of research out there. But secondly, to a large extent, they all deal with the same limitations. A lot of the research is about associations. And we would like to know more, is it really a causal effect with green space, forest being the driver of the effect? Or are people that in need of healthcare going to move into cities, live in apartments, and in that way become more disconnected, have worse access to nature? I'm coming a little bit more from the health perspective. And I think, well, we have to find a way to strike a balance between overstating the case for the importance of forest and nature, but certainly also not underselling it. And then I think it's important that we should also look into, okay, how is our forest doing, the benefits of forest, how are they doing compared to other ways to promote human health and well-being? I think there's a lot of work still to be done there. So not all approved medications are effective. So we shouldn't make it too difficult. But on the other hand, we shouldn't make our claims more than we can approve based on the research that's out there up till now.
Great, thank you. Lisa, can you hear as well?
Yes, I can hear you very well. Can you hear me?
Yeah, perfect. Thank you. You heard the question as well, right? So what are some of the highlights for you and in the work so far?
Yes, thank you. We've been looking with our writing team this how management and planning is taking these health benefits into account. And what has been visible here that we have really different situations in different global contexts, whether it's we are talking about urban situations, rural, or if we're talking about forest-dependent communities. So in this global different context, the health challenges may vary also to some extent, or sometimes quite a lot. So, and I've been thinking how well this for this discussion, how well these health benefits are taken into account in different conditions in forest management. We have in low income countries quite visible big challenges linked to climate challenges, biodiversity loss, increased storms, floodings, and so on. And they really have a big direct effect on human health. And probably these health benefits are now partially identified in this context, but not adequately. And in urban context, maybe we have more discussion and better acknowledgement of health benefits of forests, but still they are not very well integrated in decision making or planning. And one study area in the future, it would be to look more on these trade-offs and synergies. We are tackling those issues in our chapter, but how we can connect the health benefits of forest with other environmental targets, for example, to climate adaptation or biodiversity protection in the future, because it looks like there are clear synergies, or synergies can be created quite nicely if we want.
Perfect. Thanks so much, Lisa. I think that's a great reflection. Christoph, I realize you're not a forest and health expert, but you are somebody who knows the policy processes very well, also internationally. So have you seen consideration of health aspects, especially related to forest input processes? And if not, why do you think it's not maybe featured so much?
Yes, thank you, Cecil. Yeah, first of all, I would like also to say that, I mean, the work of the panel confirms that we chose the right topic. I mean, there are so many different aspects. I mean, as being not an expert on the subject, I really realized there are so many more aspects that I didn't know, and I already knew that it's needed, that we need to synthesize this information. That's one thing. So it's really good. And also the different approaches that we are discussing. It's really important to discuss that and to bring like a scientific kind of analysis of that into the decision-making processes. And coming back to your question, I mean, so far from the big policy processes, only the CPD actually addressed the topic. They did some work on biodiversity and health and the relation, and there are also a few decisions. in the CBD on that. Of course, there are the sector silos that work on health, like the WHO and so on, but this is not what we are aiming for, because I mean, for me, it's really important that we really show the contributions of forest and forest management and everything related to forests to other sectors, and especially also to achieving other SDGs. So I think it will be very valuable if we take our outcomes and feed it into a lot of processes coming, I mean, from the purely forest related ones like the UNFF, for example. Even we are now aiming at presenting some emerging outcomes at the climate COP, because WHO has a pavilion there. So this is really helpful. I think it really shows to different audiences, to these different sectors, that forests play a role, and you shouldn't underestimate this role.
Thanks very much. I think that's very good to hear. I remember also World Forest Society and Economy, right? Environment, sorry. They did a really interesting report on the SDGs and their links to forest. And one of the conclusions was that for the health SDG, there was actually surprisingly little connection made, right, between forest and the SDG, which is somewhat surprising that we still have these silos, as you say, emerging. But let's get back to that in a bit. I would like to go to Rosalind, actually, and your chapter really, we had quite a discussion, right, in the GFEP about what framework to choose. Was it One Health? Was it planetary health? Was it eco health, etc.? So what do you think, or what was one reason why the One Health emerged as one of the potential frameworks? What is the value of the One Health framework for you?
Yeah, thanks. And these were indeed very interesting discussions as you have these different systems kind of concepts emerging from different backgrounds. And the One Health really kind of helped in also in the policy arena, as well as that science policy interface, to emphasize the interdependencies between ecosystem health and human health. And while it originally focused on kind of zoonotic diseases particularly, it really evolved over time to be much more broader in terms of how it includes ecosystem health and human health, and the interdependencies in two ways between them. And we also learned from kind of the evolution of that One Health perspective and how it has been used, or sometimes not used, of course, in policies, that it helps broaden the solution space in the health community, as well as in the ecosystem and forest community. So it helps to see people in public health, to see solutions in ecosystem management, as well as to help see people in environmental management, to link to the health community and to find stewards for forest management and kind of more specific forest management for multiple social benefits. Then also kind of with the emergence of the field of planetary health and the link between One Health and planetary health, it again emphasized this urgency and kind of these rapid changes that we are seeing. And then maybe just to end is also to re-emphasize that this concept of One Health resonates actually with a lot of different people, with in the agriculture community, in the environmental community, in the health community, in also education community. So it resonates, it has some kind of communication power also. But as said, there is this kind of convergence between these different systems types of approaches. Yeah.
And would you say that the health professional health sector is getting more involved in these questions? Is that your experience?
Yes, from my perspective, it's definitely my experience. I think also COVID has kind of further triggered that to involve, to create much more awareness of it and to give it a boost. Yeah, I don't know if others want to add to that.
Feel free, Sjerp. No.
Yes. Yes. Coming back to the One Health, I think saying healthy forests are healthy people, it's a little bit too simple. We also talked about the nearness being important for many of the health benefits. Mm-hmm. So you can have a remote healthy forest, but in the short run, it may not do very much for your health. But forest in itself, it's important, especially if it generates health benefits, because if it's not healthy, it cannot be sustainable and have these benefits in the future. So that's, I think, yeah, we should not oversimplify some things. They sound very nice sometimes. And I also think we have to be a little bit careful by looking very specifically only at forests when we doesn't fit really well with the One Health approach. Right. I would say you have to look at everything, and from the person perspective, it may matter a great deal if the forest is the only natural area in your living environment, or you have a city park nearby. May not qualify as a forest, but may compensate for the absence of the forest. So it's very important to also look at that type of relationships, and of course, Lisa already talked about it, the importance of knowing more about which characteristics of forests are important for which type of health benefits. And I would say we would also like to know more about the size of health benefits, more or less regardless of how you measure them in economic terms or in other terms, because of trade-offs that need to be made. Mm-hmm. In one of the plenary, the keynote speakers talked about that SDG 15 was already the result of a lot of discussion and debate, and okay, that happens, I guess, with all SDGs, but the big problem is then it's multiplied if you talk about trade-offs between different SDGs. So, and then I think it helps if you can say something about size of health benefits that can be expected, and well, we can talk about how you best express those benefits in monetary terms or not.
Right. Thanks for those considerations. I think in the report, especially in chapter 3, right, you really broaden it. So you actually take green spaces wider, for example, especially in urban areas, right? Because it's hard to distinguish forest often. There's often not very specific research on forest, for example.
Yes, that's a practical issue. A lot of the research was on green space in general, which included forest and trees. So that there's that. But also, I think, continuing what I said before, it's not necessarily a bad thing. You can have a study looking specifically at the benefits of a forest, but you usually can only do so for the short term. People go into the forest, and then you can measure things, ask them things, and say, okay, what's the effect of the forest visit? But if you're more interested in the long-term health and benefit, people don't only go to that one specific forest. They may visit other forests, may visit parks, whatever. That may also influence their health in the long run. So from the people perspective, I would like to have a more integral look, and you can distinguish the contribution of forests, but you should take the other natural environments into account also. And okay, and most of the research, it's only all lumped together into green space. Okay, we can do better than that.
Yeah, thank you. I think one of the things that we probably face, right, is that it's hard to tease out sometimes, as you say, the green space side, but also, yeah, how are people actually interacting with different types of forest and green spaces over their week, over their year, over their life. So it is pretty complex. In terms of the health professionals, the good thing is we have a few people with medical backgrounds on the panel. So one of your co-leads, for example, Payam Datvand, and also Mathilde van den Bos have a background in medicine, which really helps, I think, sometimes to filter out some of the messaging as well. Lisa, Sjerp already brought up this idea, right, of different types of forests, different types of characteristics. So somebody who works a lot with forest planning, forest management issues as well, to some extent, landscape management. Have you seen consideration of health benefits in forest planning and management?
Well, I think we see in high-income countries more interest to establish health forests and provide services also for citizens, urban people, to encourage and visit a forest on a regular basis. In Finland, we have quite a nice discussion going on about the health benefits of forest already. There are also this medical sector is increasingly thinking what they can do to integrate this nature-based or forest-based solutions to social and healthcare services. It's in the beginning, but still it's going forward, and that's really positive. But if we think globally, as I mentioned, we have really different contexts. And if we talk about urban situations, so these same health challenges seem to be shared no matter where we are in the world. But then in rural areas, we have different situation. Forests are the living environments for rural and forest dependent people, and we have really big drivers that change that environment quickly. And how do we integrate the health challenges, health benefits into forest there, where we are talking about forest loss, biodiversity loss, transforming forest land into food production. These are really, really big challenges, and we see these big natural hazards, storms and floodings and so on. So I think we have to think about regional solutions, how to bring the health benefits into the agenda. And one solution is more multifunctional, multi-objective management in forest that don't provide only partial solutions to current social, economic, environmental problems, but they approach these today's challenges more holistically. That multifunctional forestry could join it could lead to joint production of environmental, social, and health benefits, and also keep the timber and biomass production there somehow. It's a challenging, but this would need an attitudinal change in forest sector also, because one aspect here is also that this type of new targets that are strengthening are needed to be put into practice in the future. They also raise concern in traditional forestry. What does it mean to our current practices, increased growth demands for biomass, timber, and so on? This is also something that we have to find synergies and think about the integration to the current situation, how we are using forests.
Thank you. So yeah, it's a little bit like our keynote speakers this morning also said, right? The forest has to do it all, which can be a bit of a challenge, maybe especially when it comes to the global south, the lower income countries. Iwao, I mean, somebody who is from that part of the world. How would you see maybe the health question? How is it different if we move to low income countries?
Well, yeah, I know the global south more. I just came to know the global north while working with you all. I was amazed, like how much research are out there. People just designing hospital to include green spaces to like improve recovery of patients. I was just amazed. In the global south, the issues I think are different because, as I said earlier, the health problems are quite different. For example, we talked about childhood diarrhea, how forests kind of help mitigate that. Forest filter water, which help a lot. The existing evidence say that it helps like reduce childhood diarrhea downstream when forests are like located upstream. And like forest also like, we still need technology. We need chlorination, we need water treatment. Forest can't do everything. We can't assume that there's forest upstream and the water will be like fine to drink. We still need technology, but the issue is when as we saw yesterday in where we went to the excursion, like when raw water is clean, then the cost is a lot lower, which will help those people where they don't have much infrastructure and resources to deal with. But coming back to what Lisa said earlier, how is this like health integrated to like for forest conservation and forest management in the South? I think that it has not been there until recently, particularly as when COVID happened, then like people rush. Well, as a researcher, you want money, right? You want funding, and like people are like so excited about it, so it's easier to get funding if you do something about it. But like we learned from the presentation earlier today, like there was this history of conservation. I have background in forest conservation, so that's what I know. Like before the 1980s, we have like this fortress conservation, like just protect forest, don't care about anything else, protect it. For it not to be destroyed. Then after from the 1980s, then we came to realize, no, it doesn't work, by the way. We have to take care of those people that depends on the forest. And then forest conservation and or management were integrated with like different developmental projects. Some are successful, others are not. But in those integrations, people kind of assume that when people get more income, when people livelihoods improve, they will become healthier, which is not necessarily true. Right. And what happened recently, particularly when COVID happened, is like people come to realize that we really have to like very intentional to integrate like health goals, integrate health goals in conservation, like really setting goals like by within 10 years, childhood diarrhea is reduced by 5%, and how to integrate that with forest management practices and conservation. It's not easy to make that integration because we realize that a system approach is needed currently. The world is still compartmentalized, is that a word? I think that is. So it's very easy from top, like the government or international community, to do that integration. But if we really want to succeed, I think there's no way around. We have to look at it from a system perspective. We have to work with public health people. We have to work with other people on how to really like put health goals within forest management, or if there are other important well-being goals, how can we put everything together? And that is really relevant in the global South.
Thanks for sharing that. I think your example of childhood diarrhea is such a strong one, right? It shows that there's such a direct opportunity for doing more in terms of forest and health. So thanks for sharing that. And I think also one of your lessons, the COVID-19 one, is somebody once said, right, never waste a good crisis. So there's actually always like a silver lining to anything that happens, I guess. So good, at least we see more attention. Sjerp, you already went into this topic a little bit, but where do you see some of the biggest knowledge gaps or research gaps today in terms of forest and human health relations?
And the research gaps, yes, already mentioned some of them. I think. Well, we would like to do more research. We need more research on actual interventions, I guess. I mentioned most of the research is cross-sectional. Everything is measured at the same time. You find associations, but is the relationship causal or not? So interventions and evaluating interventions could be very useful. A very nice example I came across a while ago was the evaluation of the Million Trees program in New York City. It was a very nice study showing that already after the first couple of years of the program, the quality of life in New York City increased compared to those in surrounding cities. And it was only the case when the trees were in leaf, which signifies to me, okay, it really has something to do with the trees and not with other things that might have been going on in New York City because of a new program of the mayor or something like that. So it was a very nice example of a large-scale environmental intervention that was the researcher was lucky enough that the data were already available. He didn't have to gather the data on quality of life. There was an ongoing survey year after year, and he could make use of that. So I think this type of almost a natural experiment is very rare, but it's very powerful. So if we could have more of those, that would make me very happy.
Great. So I guess that would probably end up in the report in the end, right? This kind of call for this kind of research. Christoph, a question to you in terms of GFEP and maybe even IUFRO's role in this, right? What could IUFRO do apart from now issuing this report? I mean, we've had a task force on forest and human health as well. What could be a next step for IUFRO to actually take this topic further?
Well, does it work? Yes. First of all, I would hope that all our colleagues at the panel would maybe stay with IUFRO in some kind of relation. And we could then maybe like promote like further research on that. That's one thing. But and for me personally, this is of course most important that we communicate the outcomes and also in the role of forests generally much more than we used to do now. And I mean, we have tackled a lot of topics already, but human health we never did in IUFRO so far. I mean, there was a task force on various dealings, as far as I know, very specifically with a few aspects of it. And also, I mean, as we heard, I mean, there was not a lot of information available from the global south. This was also more focusing on the global north. So this is now a real big step that we include the global south in this global assessment now. And I think this we should do in the future too. And in the next years, we definitely will work on communicating this. And I think IUFRO definitely has to increase its efforts at the science policy interface, because I feel it's so important to feed the scientific information into these processes. Perfect. And it's also, I mean, one more point. Sure. I mean, for us, approaching the political decision-making in the health sector is totally new. Mm-hmm. We know our forest communities quite well, also the decision-making communities, but we do not know the health community. And this is also something that we need to work on.
Great, thank you. And I guess so some of those processes around One Health, planetary health could actually help maybe to find platforms, right, for IUFRO as well. Yeah, thanks so much for sharing that. Actually, time is running very fast. This is really interesting, but we also have our flash talks illustrating some of the research that's ongoing. So maybe a final question for all of you, and I think I'll start with Lisa online. So Lisa, you personally, what are you going to do to promote the health benefits of forest in the next steps of your career?
In the very near future, of course, I will be very active in this team preparing the review. But I'm actually we are preparing a Finnish-speaking policy brief about the health benefits of nature and forests for larger audiences, for decision makers. So try to contribute and increase the knowledge transfer to different sectors the coming winter through this. And I'm also now working for Ministry of Agriculture and Forestry for the rest of the year, helping to compile Finnish forest strategy 2035. So I have a chance to try to bring in ideas how to integrate this type of targets into policies. And we also have just launched the Finnish outdoor recreation strategy, where actually now the health aspect is well included. So we have their important targets, how to secure nearby nature for people. So this is what we are trying to start implementing during the coming months. So I will be working also with these topics. So this is the near future, how I'd like to contribute to strengthening the knowledge transfer of health benefits of forests.
Perfect, thank you. It's good to hear that you're already right on that policy science interface. So that's fantastic. How about you, Rosalind? What is your immediate perspective on this topic, and how are you going to contribute personally?
Yeah, thanks. Yeah, I'm putting a lot of my efforts on supporting global, local, collaborative learning and co-creation processes to really bridge kind of these challenges of cross-disciplinary actions and research to try to take that to the next level. I mean, it has been said that there is a general recognition we need to do more systems approaches, but how to really do it and how to actively manage kind of these processes for better collaborative learning and co-creation locally and in combination with globally. And then also very personally, I hope to continue as a steward for local forest and green spaces. Yeah.
Great, I like that. I mean, your own personal stewardship agenda as well. Excellent. How about you, Iwao? Somebody who is between both worlds, right? The US, Madagascar.
Well, I'm in the US, but my research is in Madagascar mostly, and in other parts of the world too. But I have two plans in the near future. As I said earlier, I think really it's important to design interventions that integrate forest conservation and human health. So I'm like, that's one of my priority now, to how to design, how to test such intervention and how to evaluate to make sure that such intervention both deliver conservation outcomes and health outcomes. That's one thing that I'm working right now. Another thing is related to your presentation earlier. We lack evidence on the mechanism, how forests affect health outcomes. So when I present my research on forest and like nutritional status or forest and childhood diarrhea or forest and child development, I always get this question, but what between forest and the outcome? Which makes a lot of sense. I was trained in the environmental field, so I know ecosystem services like water filtration, regulation of certain infectious disease, etc. So it was like a logic for me, but for other people, particularly those in the public health, it's not logic for them. Or forest and then childhood diarrhea. What's in between those? What's the link? So I think we really need also to work to make strong evidence, causal evidence, as Sjerp said earlier. And the goal is to convince more people to join the cause. And it's important that it's something that you need to think about. And if you just Google, I don't know about Austria, but like if you go to the site of the UN or the American government, I know more, like the budget of the CDC is, I don't know how many times more than the budget of the EPA. The budget of the WHO is a lot more than the budget of the United Nations Environmental Program. So the more we can convince more people that what these links are there, the more partners we have, the more system approach we adopt, and the more successful we will be.
Right, fantastic. That's a great plea, right? I sometimes say as well, we focus a lot on climate for obvious reasons, but actually the public health challenge has at least similar amounts of money involved in it. And actually there's a strong link between the two. So thanks for making that point. Sjerp, what's your direct contribution in the near future?
Oh, it was working on this book, I thought.
Yeah.
Well, besides that, doing research, doing research on the topic. We're about to finish a very nice large-scale study on the importance of having a garden, and especially the amount of greenery in your garden in relationship to the prevalence of several disorders, as identified by your family doctor. So that's one nice thing. And we're working on getting a PhD in a Marie Curie program, looking specifically in what can forest and nature mean for socially deprived people, and can it help to reduce socioeconomic health disparities. So I'm very much looking forward to that too. And to continue about what was said about the money for the environmental protection and etc. I think within the health sector, most of the money goes to cure and much less goes to prevention. And I think it's changing a bit, but it would be good if it changed more.
That's actually a good one, right? To get away a bit from that curative, palliative model, but actually go more into the preventive, etc. Christoph, do you want to share what you're going to do?
Well, it's pretty obvious, I think, that I will try to promote the outcomes of our study as widely as possible, communicate it to as many decision-making processes as possible and in different sectors. There's a lot of work before us in communicating the study and also in trying to impact on political decision-making, which we usually with the studies to achieve actually. And at a very personal level, maybe I will also try to integrate these health aspects more in forest management. I do manage a small forest and also kind of, again, try to persuade my neighbors to recognize how important other aspects than timber are for their lives, and which is one of my mission at home.
I think that's fantastic. Maybe there actually the impact is going to be even bigger. So who knows? Can I get a big applause for the panel for the fantastic contribution? Thank you. Thanks so much. So I would suggest to make a swap. So if the panel could kindly leave, and then the flash talk presenters who are here, so Sjerp can actually stay. I know there's a few more in the audience. Please feel free to join me here. So we're changing gear now. We're going to 9 flash talks from 4 different continents. And we will see how I have some really fantastic help. Carola Egger is here, as always, helping us. Actually, I have Diksha Devkota as an online moderator with me as well. So let's see between the 3 of us if we can manage this. And we'll start, and they all have 3 minutes sharp. And I asked them to be very sharp because lunch is in exactly 28 minutes. So let's see if we get through it. And we'll start with Sjerp de Vries, who you all know very well. Sjerp.
Morning. Okay, thank you. I wanted to tell you about a new approach to the valuation of the benefits of forest ecosystem services. And that's basically because it's usually done very much so in economic terms. National capital accounting is very popular nowadays, expressing things in exchange values. Well, that's not something that the Millennium Ecosystem Assessment was starting with. It proposed to look at the consequence of ecosystem change for human well-being, and that does not equate with exchange values. So I want to go back to the basics and using quality of life as an endpoint, an overall endpoint, as a criterion to evaluate the changes in ecosystems. And quality of life to me is more or less the same as long-term well-being. I don't know if you're familiar with this model. It's a kind of new version of the model of the Millennium Ecosystem Assessment. I like this one slightly better, partly because of the colors. But I want to expand it a little bit. And now you see on the right-hand side, quality of life as an overall indicator. It was already mentioned, the small print said human well-being. But let's take it one step further and try to integrate it in quality of life. And the idea is that there's a lot of social science research on quality of life and what's important for quality of life. Can we make use of that? And can we then say which categories of benefits of ecosystem services is how important for the quality of life? What's the relative importance of the ecosystem service benefits for quality of life? And which ecosystem services are most important in generating those benefits? And behind that, which ecosystems are best suited to offering those services, and future-oriented, which of these ecosystems are most likely to be affected by ongoing trends and transitions, climate change, urbanization, etc. Quality of life approach, how will it differ from other approaches? Well, it departs from the individual, not from the ecosystem. And I want to stress that the service offered isn't always the service used. Think of the remote forest with no people living nearby. Use matters, therefore location matters, nearness matters. Not looking at an individual ecosystem in isolation, but what's in your living environment. It's about long-term well-being, not momentary well-being. It's about the total supply of ecosystem services from all kinds of ecosystems in the neighborhood. And it's also important to mention that use is not always intentional, not only purposeful recreational visit methods, and also people are not always aware of the benefits, but they are still there.
Perfect. Oh, you're even quicker. Fantastic. We won 10 seconds there. That was fantastic. Thanks a lot, Sjerp. So next up is Sebastien Orazio from the Bergonié Institute in France.
So good morning. So I will present you a pilot study proposing to assess the link between the risk of blood cancer and living close to the forest. And so several studies have shown a positive effect of nature based on forest therapeutic intervention and human health, such as decrease in high blood pressure, stress reduction, improvement of mental health disorder, and other systematic effects including an improvement in immunological parameters and inflammatory parameters. So these immunological and inflammatory disorder are often associated with an increase of risk of cancer. So it's natural to ask whether the nature-based therapeutic and more generally the fact of living close to forests will have a positive or negative impact on the risk of developing cancer. So in your pilot study, we are particularly interested in the link between blood cancer risk and living near forest. And the retrospective ecological study is proposed on 8 French administrative areas covered by a population cancer registry over an 11-year study period. And it will focus on the specific subtype of blood cancer associated to forest area like multiple myeloma, large B-cell lymphoma, or leukemia. And this study use the Rose percent of forest area in the commune and iris as a proxy of exposure. And so commune and iris are the smallest French administrative spatial units that we used. And for example, the map shows the geographical area of the study as well as the forest density per commune. The statistical distribution of the number of cases observed around forest area will be compared that those obtained under hypothesis of 0 and 50% distribution and taking into account of potential confounder variable and spatial autocorrelation. And this study will examine cancer blood risk for major subtype by 5 years age group and sex and calendar year. And we investigate whether there is an increase of blood cancer risk in population living near forest area. And here, for example, of large B-cell lymphomal risk curve as a function of forest density. And we can observe that the risk seems to decrease with an increase of the forest density. And to conclude, such an ecological study will improve knowledge of the relationship between forest and human health. However, it will not make it possible to conclude as a possible causal relationship. And in addition, this pilot study will determine if technical challenge related to data collection or analysis can be resolved. And so the answer is yes. And future collaboration maybe will improve your results.
Perfect. So, so well rehearsed. Fantastic. So far, so good. So let's see if our next good friend is also able to manage the challenge of the 3 minutes. And he is actually a local, Dr. Arne Arnberger from Boku in Vienna. Arne.
Okay, welcome. I will talk about human health benefits of walking forest and present results from a field experiment in a nature park in Austria. So while many studies have revealed positive effects of green environments on human health compared to built environments, little is known about the health effects of different types of green and blue spaces on humans, as we had already heard this morning. Such information, however, is necessary for successful development of health-related offers such as health walking routes in forests. The community of Geras is located in Lower Austria, is characterized by a nature park with coniferous and deciduous forests, arable fields, and fish ponds. And it's working. And the local ACTIA group is working on the regional implementation of health-related offers, such as a walking route. Thus, the question is whether there are differences in perceived and measured health benefits of the walking trails in different environments of the nature park. These are deciduous forests, coniferous forest dominated by Norway spruce, and open land dominated by a fish pond and arable land. And the question is, which trail is the best one? To test the impact of these environments on human health, 27 probants walked 3 routes, which lasted, the walks lasted about 1.5 hours, while measuring health impacts on a physiological level by measuring pulse and blood pressure, mental level using a cognitive performance test, and well-being before, during, and after the walk. The results of these standardized measurements showed positive effects on the health of the probants on all 3 walk routes, on a psychological and cognitive performance level, as well as mostly on a physiological level too. However, there were differences in health benefits between the walks in different environments. The coniferous forest routes showed most positive effects on blood pressure and on concentration performance. The deciduous forest road had the most positive effect on pulse reduction and perceived stress reduction, the recreation suitability. And the walk in the open area resulted in improvements in perceived well-being, pulse reduction, and concentration performance as well, but effects were lower compared to the other 2 routes. However, this route was negatively affected by traffic noise. As all of the routes had positive effects on human health, they are also conceivable for the development of health walking routes. Overall, the 2 forest walking routes seem to be slightly more restorative than the open area route. Thank you.
Perfect, thank you. Yeah, thanks so much, Arne. You were spot on, like 4 seconds you had still left. So we have one more in-person speaker, and that is Boris Salak from the neighboring country. He's from the Swiss Federal Institute of Forest, Snow and Landscape Research, also known as WSL.
Thank you very much, Cecil. Today, I'm not going to present you a model or a concept or whatever. I'm going to present you results of the 3rd socio-cultural long-term monitoring of forests of Switzerland. But I'm really presenting you the results and not really the methodology behind that. But however, you can really download that by yourself. The report is available online, available in German language, in French language, and in Italian language. Just so far, the sample was an online panel survey sample, representative for Switzerland in age, gender, language, region, and education. And we had about plus 3,000 respondents within our sample. Due to the time, I will focus on just, on the bigger picture of the results. There's of course a lot to discuss, but I will focus on 2 major outcomes, or 2 major maybe tendencies that we have interpreted based on the data. And result one highlight is the increasing concern among the population regarding forests and its associated functions, and regarding general environmental aspects. We see some items increasing, always when I say increase and decrease, I always mean in comparison to the prior study of 2010. This is the 3rd time, sorry, I didn't mention that. This is the 3rd time this forest monitoring happened in Switzerland, even the 4th time when we include the data from the 70s. And the last data collection was in 2010, and now it was 2020, and we did it for the 3rd time. So increasing mean in comparison to WAMOS 2 of 2010, for example, the awareness for natural hazards was increasing. Also, people starting to perceive the climate change effects on the forests. Also, we have rising acceptance of forest reservoirs, rising acceptance of predators, and of deadwood forests. Of course, we also have some decreasing factors like the perceived health of the forest and the perceived biodiversity. Some of the forest functions have increased, others have decreased, but in general, we can say that human intervention is less desired by the population in this study. Overall, not in detail, but overall, we can say that the evaluation of the population is kind of in line with an expert assessment. It's shared by a broad population. Wow, that was fast. Good. But we are not only in line with experts, we also have mismatch. The mismatch is especially regarding the forest area. People perceive a decrease there, while physically we know it's an increase. And also, we would have presumed that the protective function of the forest would have increased thanks to the awareness of natural hazards and so on, but it is not increased since 2010. People perceive mountain forests more as a habitat for animals and plants, and this maybe could be discussed as there is a loss of knowledge about the connection between mountain forests and the function of the forest for protection against natural hazards. Thank you very much.
Well done, thank you. Thank you. Sorry, Boris, for stressing you out. Yeah. Thanks so much. And then we go to online, and I think we'll start with Tonjock Rosemary Kinge. So that will be a live online talk. So we see if Rosemary is with us.
Yes, I'm there.
There you go. Welcome, Rosemary. The floor is yours.
Thank you. I just share my screen, my slide.
Yes, I think you're sharing now.
Okay. Okay, I will be presenting on the traditional knowledge of wild mushroom as ethnomedicine in primary health care among inhabitants of forest communities in Cameroon. So we know wild mushrooms are used as ethnomedicine in primary health care, but they also have diverse uses. They are used as mycorrhiza, they form mycorrhiza association. They are also used as ethnomedicine on animals' diseases and decomposition in the forest ecosystem. So these mushrooms are used to treat a variety of diseases in forested communities, such as paralysis, growth, malaria, amongst others. So this research was carried out in different forested communities in Cameroon. Mount Cameroon region, you have the Kilomijum region. So what was used? We used interviews, focus group discussions, pictorial presentations to find out mushroom use as ethnomedicine in communities in forested areas in Mount Cameroon and Kilomijum Mountain. So the results we obtained showed that Termitomyces auricularia, agaricus, Dardinia, Dictoflora, and Pleuretus Rusula, and many other mushroom species were used in traditional healthcare in communities around forested area in Cameroon. For example, Termitomyces was used to treat rheumatic pain. You have Pleuretus tuberagin used to treat paralysis. You have auricularia that was used to boost the immune system. And Ganoderma species was used to treat heart diseases, cancer, and so forth. So we see that local knowledge is very important in the different communities that were surveyed, and elderly men and women played an important role in traditional health care. And edible mushrooms are important resources which local people of all nationalities, they rely on it because it's improved their health and nutrition. And this study underscores the need to preserve and document traditional knowledge of mushroom in traditional healthcare in a database. But we have done that for mushroom in relation to human diseases. But for animal diseases, we have not documented, and we are looking forward to do that. But there's also the need for further scientific research on wild mushrooms to determine their efficacy and safety. Thank you for your kind attention.
Thank you so much, Rosemary. Perfect on time as well. Thank you so much for joining us. And from one forest country, we go to another one. Let's go to Brazil. So we have Emerson Soldado and a lot of other last names, but I just keep it very short. Emerson, thanks so much for joining us. The floor is yours. Oh, you're still muted, maybe, Emerson. We can see your slide. Can you try to say something, maybe? No, you're still muted, yeah. Yeah, okay. What we'll do in this case, sorry, Emerson, thanks, we saw you, but we have actually, luckily, we have a recording, so we're going to play that. We don't have it. No, that's what I'm thinking. Excuse me, we don't have a backup video. Emerson, you know what? We'll see if we can sort this out. We'll take one of the other talks first, and then we'll come back to you. So we have one more live, if I'm right. Iwao Uehara. Do we have him live? Yeah. So we have Professor Iwao Uehara from Japan, Tokyo University of Agriculture next. Iwao, are you there?
Okay. Yes.
Perfect. Go ahead.
Can you see my slide?
I think they're coming. You're sharing, so I can't see them yet. There we go. Yeah, we can see it.
Okay. Thank you, Cecil. I'm going to present about case studies utilize local abundant artificial forests in Japan. Thank you. Okay. I have begun my forest therapy since 1993. There are two technical terms. At first, Shinrin-yoku. It is forest bathing in 1982. And one more, Shinrin-ryoho. It is forest therapy. I defined forest therapy at Japanese Forest Society in 1999. And if you think to practice forest therapy, you need purpose at first. Next step, method, appropriate programs for each client you need. And what kind of forests are suitable for the clients. Then client reaction, 4 steps. Okay, many forest therapy activities have been attempted, but forest therapy is making both of forest and human beings healthier. This time I show you abundant forest for medical utilization. A local hospital has forests in Kyushu Island, but they were typical abundant artificial forest, like this condition, no vegetation on the floor. Abundant artificial forests sometimes cause land and water disaster in Japan. So we began to tend the forest and prepare for the forest therapy. We try to recover the abundant forest. Summary of the forest. Cedar and cypress stand. Treatment method is mainly thinning cutting. Then the forest was changed brighter than before and vegetation has come back too. We utilize branches for occupational therapy and making aroma water. Rehabilitation for dementia. We set occupational and recreational space in this abundant forest. Effects of this forest therapy case decreased BPSD. Conclusion. We utilized and treated abundant forest, and we made forest and human beings healthier. Thank you very much for your attention.
Thank you, Iwao. Thanks so much. So I'm just checking. Do we have Emerson with sound or not yet?
Are you listening? Are you listening?
Yeah, we can hear you. Perfect.
Okay.
Go for it, Emerson.
All right. I will share my screen. Just a minute. All right. So.
Yeah, we can see it.
Okay. Thank you. So good morning. I'm Emerson, and I will present part of my ongoing PhD research about cyclists' well-being in different environments. So for this moment, I will present my methodology that the cyclists answered a questionnaire before and after bicycle riding. And in this questionnaire, we have 2 psychometric scales, a perceived stress scale and a 5 well-being index. Until now, we have 2 rides, one in an urban area and another one in a protected area, and both of them in São Paulo, Brazil. Both of the riders happened in a duration of almost 1.5 hours, the same temperature, and the cyclists self-reported the same median of physical effort, thermal comfort, and satisfaction with the ride. So we could compare both of the rides. For the stress, as you can see, both of the rights reduced stress significantly, and effect size was considered large in both, but a little bit higher in the natural area. About the well-being, as you can see, only in the natural area, the difference was significantly. And when we see about the effect size, only the natural area, we had a large effect. In urban area, the effect was considered medium. So until now, we can assume that riding a bicycle is good for mental health. And when we did that in a protected area, the effect is higher, showing the importance of these areas for human health. And that's what I'd like to say. I thank you, Fru, and that's it.
Thank you. Muito obrigado. Thank you.
Obrigado.
Thanks a lot, Emerson. Wonderful, it worked. And we have one more live online, if it works, and that is Amina Maalin, all the way from Nairobi, Kenya. So let's see if we have Amina with us. If not, we have a backup for her. So do we have Amina? No luck?
Go ahead with the pre-recorded.
We take the pre-recorded, Amina. We'll do that. We'll take the pre-recorded. Yeah. So Amina Maalin, do we run it from here or run it from there? Okay, perfect.
Now we know that despite rangelands supporting a large portion of the global human population and its biodiversity, is threatened by the loss of vegetation, degradation, and the continuous spread of alien and indigenous invasive species. Restoration of these rangelands has relied on scientific approaches exclusively, which yielded little success. However, this adaptive collaborative research took the approach of combining science and indigenous knowledge to restore the degraded rangelands in Garissa and Marsabit counties in northern Kenya. Participatory research methods were used for data collection, and its target population was pastoralists and agro-pastoralists of both women and men, who were randomly selected from different households, and all age groups were considered. From the key findings, 27 priority indigenous trees and shrubs and 18 grass species were identified in the vernacular Cushitic, Somali, and Borana languages. And amongst the key species were Acacia totilis and Podia sinensis, and the main grass species were Chrysopogon aucheri, which was a critically endangered grass species despite its high preference by livestock, and the other two are Estrida species and Cynodon species. The communities, however, preferred species based on their different plant need preferences and the fodder and forage preference by the type of livestock kept. And neem was found in all households. And pastoralists naturally prefer conserving rangelands to planting new trees or plants. A good example is marking of old indigenous fodder producing trees and forbidding community members from cutting them. And this has enhanced natural regeneration. You can see in the first picture, red markings on this big Acacia totilis tree. And the socio-cultural practice of these Muslim communities who are living in an extended family lifestyle of a minimum 6 to 7 members in a specific household who wash or take ablution and pray 5 times a day has increased growth and survival of trees within the homestead. See the second picture of the man washing under a tree. And the third photo is a fencing of trees planted within the homestead to prevent livestock from destruction and grazing on it. And you can see a photo of the neem. And finally, the scientific approaches complemented this study through use of zipits and water retention ditches as water harvesting techniques to enhance vegetation, growth, and recovery. And you can see the many photos of water harvested during the rain in the various and its performance afterwards. And in conclusion, having realized success in the integration of these two knowledge systems, would therefore recommend the combination and use of these two knowledge systems in ensuring successful participatory rangelands restoration. Danke schön. Thank you.
Danke schön. Thank you very much, Amina. And Amina can hear your applause because he was actually online with us. So last but not least, from Malaysia, University Putra Malaysia, Sreetheran Maruthaveeran. This is also a recording. So this will be the last one before lunch.
Greetings from Malaysia. I'm Sreetheran from University Food from Malaysia. This is a study which was conducted somewhere in March, April of 2020 during pandemic or lockdown. So we were looking into how the Malaysian leisure and recreational users were basically coping with their mental and physical health during the pandemic. So I think this issue is not only in Malaysia, but it was also a worldwide issue where during this lockdown or pandemic, many were also having mental issues, were losing jobs and also gaining weight. And also most of these public spaces and green spaces were even locked during the pandemic. So basically what we did, we approached all these groups of recreation and leisure groups through social media groups, especially WhatsApp, through WhatsApp and also Facebook. So overall, they were moderately disrupted to disrupted overall. The overall level of physical and mental health of the respondents. This might be true because the study was conducted in the beginning of the pandemic in March. And these are some of the physical activities that were conducted by the respondents during the confinement period in the house. So it seemed majority were just doing household and also just have a walk in the house. So not so much on the physical activities. It was more towards a passive kind of. And also, I mean, I think this is not only in Malaysia, but also worldwide. Many started to watch, a lot of TV programs during the confinement period. And of course, there was an increase in the communication. I mean, because we were not allowed to see our family or friends, and interstate traveling we were also not allowed. So communication was also high and also okay. And we also conducted this general health question. If you can look at the negative list of items, it shows a good sign that many were not that stressed during the pandemic. So what needs to be done? I mean, perhaps as a designer, perhaps we need to rethink on the way we design our parks or even the facilities, and perhaps on the accessibility to all these green spaces to cater the public so that they will be able to use these green spaces in the future if there's another pandemic and so on.
I think that's it. Thank you very much. Terima kasih, Sri, and it's very true. I think we all were Netflixed out during the global pandemic, so that's a fact. Thanks so much again to all the speakers for keeping the time, being super professional. We had a wonderful journey across the health topic.